Good morning everyone. Myself Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about quervain tenosynovitis. So basically what it is a pain and swelling at the base of the thumb or the thumb side of the wrist. Why it occurs? It occurs because of the swelling and thickening of the soft tissues, particularly the tendons, abductor pollicis longus and extensor pollicis brevis, which runs through here and passes through the wrist. There is pain and swelling in these two tendons. So basically, what are the risk factors? Risk factors are particularly picking up the object, grasping objects, or lifting heavy objects in the pregnancy, or we can say in the pregnant females, post pregnancy, or in the patients of rheumatoid arthritis, means pain having in the small joints. Those patients are having recurrent tenosynovitis. So what are the symptoms of the condition? There is pain and swelling at the thumb side of the wrist. There is cracking, popping sound, swelling in this particularly area. So what we can do in this? So we can take the physiotherapy treatment. So we can do stretches, we can do strengthening exercises. So starting with the treatment, the first exercise, or we can say the first would be the stretching. So we can stretch these two tendons here, abductor pollicis longus and extensor pollicis brevis. So how we can stretch the tendons? So you can first make your hand like this, then take your thumb towards the little finger, then you can take it to the ring finger, middle finger, and then to the index finger. So in this way you can stretch these two tendons. You can repeat it for 8 to 10 times, but don't irritate the tendon in this way. Or we can also do alternatively also, like this. Next, we can also stretch in this way. You can hold this position for 30 seconds and you can repeat it for 3 times. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you can count it up to 30. And then you can repeat this for 3 times. Next, we are having wrist stretching. It's very important to stretch the wrist because tendon run through wrist. So how we can stretch? In this way we can stretch. Don't put too much pressure. You can give just mild pressure. In this way we can stretch the wrist. You can repeat it for 7-8 times, not more than this initially. Then third, you can do some exercises with the weight. You can start with the half kg or 1 kg, means how much you can tolerate, or it's very important to not irritate the tendon. So we can take this half kg weight and we can do the exercises like this with the weight. Wrist flexion, wrist extension, flexion. You can repeat this 8 to 10 times initially. Then you can repeat the or we can say you can increase the frequency gradually. Then you can also do radial ulnar deviation with this. Then you can also do pronation, supination. So next we can do with the rubber band exercises. So you can, or we can say tendon gliding exercises. So in this way we can do the exercises with the rubber band. You can repeat it 4-5 times. You can also do exercises with the tennis ball. and like with the tennis ball you can do it in the 3 to 4 types with the help of the tennis ball, or there is also sponge ball. With the help of that you can also do exercises, but it's very important that don't irritate the tendon initially. So this is the only question, and it's you can also do ice pack initially, or you can say ultrasound to relieve the symptoms. Thank you.